Can you take Suboxone and Adderall together? It is a question that many people are asking, as the two drugs are often used to treat different conditions. The answer is it depends. It depends on the dosage of each medication, how long you have been taking each one, and a variety of other factors. In this video, we will discuss the potential interactions between Suboxone and Adderall and whether it is safe to take them together. Suboxone is a prescription medication used in medication-assisted treatment (MAT) for opioid use disorder and opioid addiction. It contains the medication buprenorphine and naloxone. Buprenorphine is an opioid partial agonist which effectively reduces cravings and opioid withdrawal symptoms in patients with substance use disorder. Naloxone is an opioid antagonist which deters the effect of illicit drug use and opioid overdose, making it an effective tool in helping patients stay committed to MAT. When combined with behavioral therapies and counseling, this comprehensive approach is often one of the most effective treatment options for treating opioid use disorder and opioid overdose. Suboxone is an opioid medication for opioid use disorder or patients having withdrawal symptoms with opioid dependence, but it has a ceiling effect, which stops increasing its effectiveness in reducing the craving and opioid withdrawal symptoms after a certain amount. It results in having a lower risk of experiencing euphoria from the medication or side effects. It makes Suboxone a safe and effective option for treating addiction to drugs. If you or someone you know is struggling with addiction, talk to your healthcare provider about whether Suboxone may be right for you. Adderall is a prescription medicine for attention deficit hyperactivity disorder (ADHD) and narcolepsy. Dextroamphetamine and amphetamines are the main active ingredients in Adderall. They work together to stimulate the central nervous system, improve attention and impulse control, and relieve excessive sleepiness and sudden sleep attacks caused by narcolepsy. Since MAT patients may also have mental health disorders like ADHD, they can take additional medications like Adderall. There are two forms of Adderall available, Adderall and Adderall XR. Regular Adderall is released to the body immediately when patients take it, giving them faster relief from symptoms and shorter side effects. Adderall XR works for an extended period, giving patients longer-lasting results. Talk to your healthcare provider about whether Adderall or Adderall XR is right for you. Suboxone and Adderall are two very different drugs commonly used to treat addiction and ADHD. Buprenorphine and Suboxone binds to opioid receptors in the brain and produces similar effects to opioid drugs and opioid pain medications such as heroin or OxyContin. However, because it is an opioid partial agonist, it has less intense results than full agonists, making it less likely to be abused and lead to physical dependence or opioid overdose. Adderall, on the other hand, is a stimulant that increases levels of dopamine and norepinephrine in the brain. This increase in neurotransmitters leads to improved focus and concentration. Stimulant medications, such as Adderall, are also popular illicit drugs among college students who use them to cram during examination periods to stay awake and alert. Both drugs can be effective when prescribed, but they both have the potential for physical dependence and should be used with caution. Taking Suboxone and Adderall together is not advised, as doing so can result in several risks and side effects. Some of the risks and side effects associated with this combination include severe anxiety and agitation, rapid heart rate and increased blood pressure, nausea and vomiting, tremors and seizures, hallucinations and psychotic episodes, kidney damage, liver damage, cardiovascular problems, unconsciousness, death. Furthermore, because both Suboxone and Adderall are central nervous system depressants, taking them together can cause drowsiness and slowed breathing. In severe cases, this can lead to coma or even death. Before doing so, you must consult your healthcare provider to know the risks and side effects of taking these two substances together. Mixing medication can be a dangerous proposition. Different drugs can have potential drug interactions in unexpected and potentially harmful ways. That's why it's always important to talk to a doctor for medical advice before taking any new medication, even if it's over the counter. When it comes to Suboxone interactions with Adderall, there is no definitive answer as to whether it is safe to take them together. Both drugs affect the central nervous system, and both have the potential for side effects like dizziness, headache, and nausea. In addition, Suboxone contains naloxone, which can block the effects of Adderall. As a result, it's generally not recommended to take these two drugs together without medical supervision. If taken together, it is possible to have a risk of overdose on Suboxone and Adderall. Suboxone is a medication used in MAT to treat opioid addiction, and Adderall is a stimulant medication used to treat ADHD. Both drugs have addictive properties and can cause dangerous side effects when taken in high doses. They can interact with each other to intensify those effects. Taking too much of either medication can lead to an irregular heartbeat, seizure, and even death. When taken together, the risk of these side effects is increased. Therefore, you must only take these medications as prescribed by a doctor and never exceed the recommended dosage. Anyone who experiences any adverse side effects should seek medical help immediately. Suboxone and Adderall are medications often prescribed for people struggling with addiction. While both drugs can be effective in helping people recover from addiction, they can also cause several side effects. For example, Suboxone can cause drowsiness, while Adderall can cause anxiety and irritability. In some cases, people may find that taking both medications leads to more side effects than taking either one alone. If you are taking Suboxone and Adderall, talk to your doctor about whether adding another drug could benefit you to avoid drug misuse. Suboxone is a medicine used to treat opioid addiction and is often combined with behavioral therapies and counseling. It is usually taken daily and dissolved under the tongue. Adderall, on the other hand, is a central nervous system stimulant that increases brain activity. Adderall is usually taken 2 or 3 times a day. Suboxone and Adderall can interact with each other if they are both taken simultaneously. Suboxone can increase the effects of Adderall, and Adderall can increase the side effects of Suboxone. If you need to take Suboxone and Adderall, follow the doctor's instructions carefully. Suboxone should be taken first, followed by Adderall 30 minutes later. You must also drink plenty of water and avoid drinking alcohol when you're using these medications. It is crucial to be aware of the risks and side effects of taking Suboxone and Adderall together before deciding whether or not to do so. Several other medications can be taken safely with Suboxone and Adderall to achieve better results or minimize side effects. However, you must consult your doctor before starting any new medication regimen. If you need to take Suboxone and Adderall together, you must consult a Suboxone doctor and follow the dosage instructions carefully. You must also monitor your symptoms closely. If you experience any adverse side effects, you should seek medical help immediately. Don't risk your health by combining these two drugs without talking to an expert. Visit Suboxonedoctor.com and consult our licensed Suboxone doctors, who can help you decide if you can take these two medications together. If you are struggling with addiction and are looking for help, please contact our Suboxone doctor. We can provide you with a safe and effective treatment plan to help you recover from addiction. Our team of experts is here to support you every step of the way.